Greetings everyone, a very warm welcome to our first years, our returning students, our staff across all our institutions of higher learning, in our universities, technical and vocational colleges, community colleges, and everyone in the post-school education and training system. You embark on this critical journey towards building your future. It's also a period of transition from being a teenager, at times from being under parental control, under guardian controls, into adulthood, being independent. Will come with a lot of peer-to-peer influence. This road is exciting. This road will build your future. But this road is also tough. Tough because you're young. And there are so many unknown realities that will surround you. And it's my duty to engage with you on those realities, challenges, obstacles. It's important for you to introspect, be aware, be conscious, and try your best to navigate them so that you're focused towards your future, building your career, building this beautiful life that God has given you, makes it possible for you to move on. So what are those obstacles and challenges? What we have seen is, in South Africa, 1 in 3 young women are experiencing gender-based violence. We've noticed that the cases of gender-based violence, sexual violence, partner violence, they predominantly increase in the institutions of higher learning. You all will have one or the other relationships, but you can't live in toxic relationships. You cannot allow sex for marks. You cannot allow sex for education. You have to protect each other and yourself from this massive issue of sexual violence, rape, gender violence, and other social ills that kill our young people. And you can report them, and you should report them. Justice must always prevail. We are there to help you as Higher Health. I want to again re-emphasize a toll-free helpline, a crisis helpline. A number is 0800363636. I repeat, 0800363636. 24 hours, toll-free, totally free, in a language you want to speak. Speak about your problem. Mental health is reality. 1 in 4 young South Africans in higher education at times suffer with mental health or deal with mental health. Academic stress, family stress, financial stress, as well as mental health in general does affect young people. It's an honest reality of us. You should be aware. But these things can be fixed, can be repaired, can be treated. And that's why specialists exist. Counselors, psychologists, psychiatrists. This telephone number that I expressed is toll-free line for every crisis. You are suicidal at 2 o'clock in the morning. You're depressed at 2 o'clock in the morning. You're unsure of yourself at 2 o'clock in the morning. You've experienced trauma late in the evening, afternoon, and it's hitting you. You should never be alone. This toll-free helpline will help you. Call Higher Health. Higher Health is for you, with you, and by you. Never ever feel alone. And that is the message I wanted to give you. There are other health challenges that you have to be careful about. 8 million South Africans live with HIV. Predominantly, the disease starts its infections in young people. Why young people? new sexual relationships, unprotected sex, not knowing your partner. The virus finds its way to come in you. It's a sexual disease at times. Yes, there's a lot of stigma and taboo, but at the end it's a treatable disease now. A disease which we can give ARVs at early stages, so it's not that if you have HIV, it's a death sentence. No, not at all. People can live as long as possible. It's like any other chronic disease in reality. Well, you can have hypertension, you can have diabetes. You have to take treatment. But the first and the foremost is not to get HIV, to prevent HIV. Aware of your surroundings, loyalty to your partner, wearing protection, condoms, ensuring yourself that you are at minimal risk to this dreadful disease that has killed millions and millions of people globally and in South Africa. And our higher health is fully equipped to help you test HIV, counsel you on HIV, put you on treatment at early stages. If you are at risk, there is PrEP, called pre-exposure prophylaxis. This PEP, should you be having a sexual encounter which you're not aware and you are at risk to HIV, this post-exposure prophylaxis. And you need help. We cannot have young women in South Africa having uninformed pregnancies or unknown pregnancies or teenage pregnancies. Because while you are studying and you do not want to be pregnant, this can disrupt your studies. And this is a huge challenge. Sometimes our young women are not even ready for deliveries and becoming pregnant. So sexual reproductive health is important. Accessibility to basic contraceptives. They're around you to protect you, to prevent you, to help you. I want to speak about gender diversity. About 10 to 11% of our population are gender diverse. They're proudly South Africans. They're proudly humans. One of the most intelligent brains we have, hope of the mothers. We cannot not exclude them from society. They are with us. They're for us. They have to be supported. So yes, we believe in gender equality. We should all preach gender equality. We should make sure that we respect humans, we respect their identities, and we build a good citizenship in South African thinking. And it will come through you, because you are the peers for the future. You are going to be a father one day. You're going to be a parent one day. You're going to be a mother one day. You're going to be a partner. You need to see good citizenship and building, irrespective you've had difficult backgrounds, challenging situations. We need to change South Africa through you. Drugs, alcohol, substances. This is a reality. Peer-to-peer influence. And if I tell you, 61% of our students abuse drugs and alcohol every month across our institutions of higher learning, I believe it's a huge epidemic that we are dealing with. You have to be careful. These are substances which are very addictive. They go with you for your future. They have the potential to destroy your future. If I tell you, as per WHO, 65% of every case of gender-based violence in South Africa is preceded by drugs and alcohol. It's a major challenge. We have to protect each other. We have to protect you, and we have to protect ourselves as this country. So drugs, addiction, be responsible, please. Try to avoid it. try to not be under the peer influence. Say the word no, be bold, because it can destroy your future. Disability. Students with disabilities, people with disabilities, staff with disabilities, they are highly vulnerable to gender-based violence, to mental health, to HIV, to all the social ills and health ills. And it's very critical that we do not exclude them from our society. We need skills from them. They are equally hope of every mother or a parent or a guardian. So understanding disability, and maybe one day we might be disabled too. But it is important for us to understand disabilities, support disabilities, respect disabilities. They have special needs, special reasonable accommodations, and my request is to every institution to meet those needs. A reasonable accommodation package for a partial deaf student, to a quadriplegia or a paraplegic student, to an autism student, even as deep as diabetes. Young people sometimes who are born with diabetic need insulin, they need breaks. Reasonable accommodation and respecting students with disabilities is important for us if we want to build our economy and our nation. So colleagues, family and friends joining higher education, I request you to join the higher health programs. I want you to join and become higher health's unsung hero, which is the peer educator. Every year we build 10,000 soldiers in this country, the unsung heroes. Every day they spend their life in preaching what I preach to you now: HIV, gender-based violence, mental health, addiction, disabilities. Talk about these issues which are stigmatized. Make more people aware. You never know, sometimes when you talk, somebody introspects and takes help, and the life is saved. An engineer is born. A miner is built. A normal South African gets a future. So never hesitate to teach others. And teaching others is the beautiful profession that God has given us in the form of a peer-to-peer. So be the higher health peer educator. I'm waiting for you to join higher health peer education program. Equally, I'm encouraging every South African in higher education to join and get an NQF level 5, which is higher certificate, higher health civic and soft skills qualification. 90 hours of learning time on your phone in the language you want to, as a co-curriculum. The 10 soft skills in the workspace. Remind you, 85% of job success after you leave higher education is dependent on a soft skill. So why not get your CVs a little bit more, sorry to use the word sexy, so that from higher health in 90 hours, in 300 notional hours, on a weekend, bedtime stories, complete this curriculum. Get this soft skill qualification on your CV. It will teach you on issues of mental health, civic education, climate change, drugs and alcohol addiction, building resilience, gender studies, and more importantly, the soft skills. Empathy. It also includes financial literacy, digital skills, teamwork, conflict management, leadership, decision making, counseling. These are the skills that are very progressive. Well, the world is moving towards soft skills. So come to higher health, enroll yourself, and get this. And build South Africa. You have clinics around you, higher health mobile services, your own clinics around you in the institutions where they are. the 24-hour crisis helpline, which gives access to counselors, psychologists, nurses. Seek help. Do not hesitate to not ask for help. These toll-free helplines are built for crisis management. At the end, we need you. We need you to build a future, because through you, we build South Africa. I wish you all the success, health and happiness in 2024. God bless you, and we're looking forward to have you in higher health. Thank you.